And this next person who's going to join us, I know that a lot of you are probably familiar with, have had the true honor of encountering over the years. He's been around for a while. He works with us here at the California Prevention Training Center. Mr. Tim Vincent is going to be talking to us about cultural humility on an institutional level and how can we ensure that the efforts that we're making are culturally humble. So without further ado, Tim.
Good morning, everybody. How are you doing? Again, as Patrick said, I'm Tim Vincent, and I am with the California Prevention Training Center as a senior consultant. Before I get moving forward, I need to see that you're with me. Give me some sort of, I don't know, either put your cameras up or give me a thumbs up. Give me a celebration, put in chat, let's go. I'm here, let's move it forward. You want to hear this? Come on, give me something. I need to know that I'm not just looking at blank screens here. All right, Bertel, thank you. Bertel, how are you doing? It's like, hey, how are you? I'm starting to see people I know too. You've been, if you know me, you've been doing this for a long time. Anyway, you're here. Hey, Tim, all right, Anshay, let's go. Let's get it going. I need to know that you're here and you're with me. All right, let's do it. So I'm going to be talking about cultural humility from an institutional perspective, and also from creating structural interventions to really respond to cultural humility. And I'm going to be talking about a particular project from the state of Louisiana that I've been given permission to talk about, and that I've also worked as a technical consultant on. So that's what we're going to be doing, and let's go. So here we are. So this piece, what I want to talk about is how structural interventions can increase cultural humility within HIV-focused organizations. I want to talk to you about identifying some steps to creating structural change to promote cultural humility. And then I want you to consider at least a strategy you can think about that would support institutional change that would really help to promote cultural humility in the work that you're doing, in the places that you're doing it. So that's what I'm doing. So here's how it's going to happen. I'm going to talk about cultural humility and cultural humility principles. I'm going to give you, as I said, an example from the state of Louisiana. I'm going to talk a little bit more about other strategies that you might consider that would promote cultural humility on a larger level. I want to talk about some lessons learned from the project in Louisiana that I think are really helpful for you all to hear. And then if there are some questions or some thoughts or some opportunities to hear from other people, that would be great as well. So I want this to be interactive too. So let's go. So I'm going to talk about cultural humility and cultural humility principles. The first thing I want you to do, and I want you to put this in chat, please put this in chat. Well, how would you define cultural humility? What is it? Help me. What is this? Tell me what it is. A couple words. What is it? Put that in chat. What is cultural humility? So if we're talking about really instilling it on a larger structural institutional level, what are we trying to do? Respect. Thank you, Gloria. What else? What else is there? What other words would you say? Respect for who? Learn, to be able to learn. Okay, what else is cultural humility? Removing assumptions. Thank you, Jamie. Don't make assumptions or generalizations about everybody in the group is the same. Thank you, Alicia. Listen. Thank you, Raj. No assumptions. Understand, give respect. Put yourself in other people's shoes. Thank you, Michelle. That's a big one, I think. So thank you for putting that out there. Sympathy. Don't ask too many questions. If you don't know, ask. Really, culture, trauma-informed care, understanding the other person, cultures, respecting other cultures, not assuming that I know much about a culture I'm not a part of as a member of the group. Yes, great, Neil. Thank you for adding this. So all of these things I think are important in understanding what we are trying to achieve when we get to a cultural humility approach. And so just to set this up, because I think many of you know this, but I just want to make sure that I set this up before I talk about the particular example I'm going to give you, that cultural humility is a continuing lifelong process where an individual examines their own beliefs as well as the beliefs of others and the cultures of others, so that it can really be informing what you all were just talking about. They can have respect, they can really know what they don't know, really recognizing that you're not going to know everything about anybody, all that there is to know, that the people are really the experts in their own life, that you're relinquishing in the second bullet, you're relinquishing the role of the expert to become a student of the person that you're working with conviction and with knowing that the person can be a full potential partner in this collaboration that you have, that is really what you're going to learn from them. So many of the things that people were talking about earlier in some of the presentations about getting information from people, really having it being informed by community, really knowing that what people experiences are the things that need to drive the work. So that's really around what cultural humility means. It has 3 principles. One of them is lifelong learning and critical self-reflection, meaning that this is a continuing process where I'm going to recognize and be evaluative of myself, what I'm comfortable with, what I'm not comfortable with, what I know, what I don't know, that's going to be an ongoing process as a person who's providing services. That the second principle is really recognizing the power imbalances and what I can do or what we can do as a group, as an institution, to mitigate those power imbalances so people have a voice, choice in what is offered to them, and access, as we've been talking about earlier in thinking about structural interventions. And then third, which is in some ways maybe the most difficult one, is the institutional accountability. What do we do as an institution to instill that the principles that I just said, lifelong learning and critical self-reflection and mitigating power imbalances, are really happening at an institutional level? So now I'm going to talk about this as how you think about these particular principles and some of the interventions you'd want to do around them. So if we're thinking about interpersonal interventions, that's about really helping people to understand themselves, understand their worldview, their beliefs, their biases, so that they can do more effective and culturally humble work. Interpersonal is really recognizing the power imbalances that happen in the provider and client or patient role, and what you want to be thinking about to help to change those dynamics to make them as equitable as possible. And then structural is really about how the organizations, the systems can create environments where the individuals experience power and can access and deal with and mitigate some of the barriers that create disempowerment and create safety. And so that's what we're going to be talking about a little bit more in the example I'm going to give you. So here's an example from the state of Louisiana. This is a long, many-year process that they did that created a series of structural interventions that I would say help to change and focus on cultural humility as it relates to the populations that they were very concerned about. So here it is. And again, a number of the presentations and some of the thoughts that you all had earlier really inform what they were doing. So they were really looking at data. So they looked at the inequities that were based on race and recognized that the inequities in Louisiana were based on race, sexual orientation, and gender identity, and they were persisting. That the HIV rate for Black or African American people in Louisiana was over 7 times higher than those among whites. That transgender women that were tested, this was when they were doing this, was in 2014, were twice as likely to have a positive test result than men that were tested, and over 8 times that of cisgender women to have a positive test result. So they were looking at the significant disparity that transgender women represented. That the percentage of adult HIV diagnosed cases attributed to gay, bisexual, and other men who have sex with men peaked at the time that they were looking at that at September in 2015 at 70% versus a low of around 50%, 10 years earlier. And so looking at all that data, and again, there's more to this, but I'm just making this as a summary of this. Looking at all of that, they recognized that what they wanted to do by looking at that disparity was to focus on the institutional way in which racism, homophobia, and transphobia exist in the health department and their partners. And they wanted to address those issues and those inequities so that they could build an anti-racist and anti-heterosexist institution. So it really wasn't going to be so much about the people that it really was going to be about the people they're serving, but the way they're getting to that is to look at what is the system that we've created that has continued to create this inaccessibility and this inequity among the people that are most overrepresented when talking about HIV. So when they're thinking about, again, this is Louisiana, when they're thinking about creating an anti-racist and anti-heterosexist organization, they recognize that this is true, that stigma is complex and rooted in intersectional oppression. What was really interesting to me just now in the presentation that Matt just did is when he was showing the slide about what the different jurisdictions wanted to focus their efforts on. In that middle range, I saw that there was there was a number of organizations that said they wanted to look at homophobia. A number of them said they wanted to look at transphobia. A number of them said they wanted to look at systemic racism. And then rooted in all of that was at the bottom was saying that it was stigma was in some ways something that also connected all of those things, at least here in Louisiana. They really realized that it's complex and it's rooted in intersexual oppression. And that the inequities that are based on race continue to, and sexual orientation and gender identity, like I said, continue to persist, and that they wanted to focus on the institutional way in which racism, homophobia, transphobia exists. And so before I go any farther, I want you to tell me this. So tell me this in chat, if you can tell me this in chat. Would you say that this is Louisiana, but I'm talking about the places that you're working in. Would you say that homophobia, transphobia, systemic racism have something to do with the inequities that you're seeing in your groups with regard to HIV? So put a Y, put a yes, unmute yourself, say yes. All the above, yes.
Michelle says yes. Michelle says yes, yes.
Yes,
Timo,
yes.
yes.
You're gonna put yourself off mute. It could be an amen, a yes, a yes, a yes. All right. So we're seeing a number of people who are having similar ways in which they're noticing what happens in the communities that we're serving. And so it was really part of a HRSA and CDC process called the CAPAS project that really initiated this particular thing that I'm talking about. And what was interesting about this particular project at the time is they were asking the states that were funded to do this to really focus on a social determinant or social determinants in looking at the disparities. And so what I'm just showing you was Louisiana's response to that, because they wanted to look at the social determinants that really were, to them, the root causes of the inequities, which was, again, systemic racism, homophobia, and transphobia. So what they first did is they decided to make or require the entire health department to go through a series of workshops. One was on undoing racism by the People's Institute for Survival and Beyond out of New Orleans. And the second one was through a technical assistance project through us at the California Prevention Training Center and at UCSF's Transgender Center of Excellence on homophobia and transphobia. And so they really made that the first thing, which was really that level in terms of having people to really have them lifelong critical self-reflection, the first principle in some ways of cultural humility, really looking at the historical context of oppression, really having people have a connection to the experiences that oppression has had in those particular areas and how they've experienced it, and to really analyze how the oppressions play out in the workplace, who gets hired, who's in power, who gets to decide what happens with whatever programs are happening. So that's what they were wanting to start to look at from that. And through the
bring that back in.
again, can you put yourself on mute if you're not on mute, please? So shifting the organizational culture to focus on health equity, what they wanted to do and what they did is they really looked at one of the things that was really important for them to just start with is to have common language in which the entire group of people could speak about that had to do with institutionalized oppression, really understanding what we mean by racism, homophobia, transphobia, really having ways in which people would understand what they're talking about. And that was a process. I'll just tell you, because I was working with them. That was a process to get there, but it was an important process to have. They also, just to say this, they required everyone to do this. And when I say everyone, I'm talking about people who were at the security door, the people who were doing data analysis and never saw clients, people who were at the front desk. They made that was a requirement that people had to go through this. And that also helped them to improve an onboarding process for staff. So they really made it sure that since this happened, that was a requirement that was part of a person's onboarding process. They would have this training and have this way of understanding the language that is being used at the health department level around disparity and oppression. They created new positions to serve the LGBTQ communities and communities of color. So that one of the structural changes was to actually change how they, what they hired and how they, the staff positions that they were looking for. And again, what they did, because we first started these workshops in New Orleans and Baton Rouge, they created it so that it was a statewide initiative. And to do that, one of the other structural changes that needed to happen is they needed to build capacity to have people trained. So we didn't, when I say we, the California Prevention Training Center and the Transgender Center of Excellence did many of the trainings, but then we did training of trainers so that we left and they had the capacity to continue to do these trainings, and they still do these trainings. So that was some years ago. So that's another structural change that has happened as a result of that. So the other things that they did is that to really focus on health equity is they had a renewed commitment that happened. And they really, again, I already said this, required the new staff to do this. And they also changed the way in which they reported data and to create annual reports, fact sheets to communicate to providers that really highlighted disparities and gave them some contextual information around structural barriers like poverty and incarceration. So really bringing in social determinants in the data story so that providers would have a more an appreciation, that's a funny word, but a more understanding and awareness of how those structural barriers create the disparities that they're seeing, and it's not just about identity. And then lastly, what they've just created in the last year or so is something called a SOLID initiative, which is strengthening opportunities for leadership, inclusion, and diversity. And so what they really wanted to make sure that they were doing is at a larger institutional level, creating pathways of power. So again, mitigating the power imbalances that happen among particular communities at the institutional and health department level. And so SOLID is an initiative that aimed to dismantle white supremacy, transphobia, and heterosexism at New Orleans area medical research and public health organizations that provide services to LGBTQI plus people of color and people of color, hire from within the community for entry-level community-facing positions, but are helmed by people who are almost overwhelmingly cis and white. So really what was happening at the time when I was working with them is really the positions of power were really overwhelmingly represented by people who were cis and white and not from LGBTQ plus and people of color. And so they really wanted to look at how you change that. And so they really wanted to confront the racial, gender, and economic injustice and build power and leadership by providing a leadership program, professional development to LGBTQ plus QI plus staff of color at partnering agencies. It has, just tells you a little bit about what it is. It's twice monthly sessions with an executive coach. It has monthly educational convening on topics that range from racism and the HIV movement to self-care to healing. So they really created this structure, another structural change, to really make it so that the power dynamics can shift and the leadership could also shift in a way that would be sustainable and powerful. And so again, to create positive, sustainable change by identifying the unjust and inequitable policies, hiring and promotion practices. And so this was done through a comprehensive organizational assessment, community advisory board, all of the things we've been talking about with regard to how you make these changes happen. It provides technical assistance to employers to create institutional development plans based on results of the survey. And so really what I would love to give you later is a little bit more information about how this happened, because I think it's such a comprehensive and thoughtful process of a strategy that keeps moving forward with creating equity at the state of Louisiana for their HIV prevention and care work. And so the Black, Southern, queer, and trans people of color face the issue of it, face mounting threats to their lives and livelihood in 2020. The persisting pandemics of racism, anti-Blackness, transphobia, homophobia, and HIV have collided with the COVID-19 pandemic. And it really is laying stark contrast with the disparities that people face, that the health and well-being of our communities must be in our own hands. So again, by us, for us, by us. And the leadership of institutions that work toward our health and benefit have to benefit from our expertise on the front lines, must look like and love and live like us. So the SOLID community aims to make that a reality. So that's really what they have created, which I think is a way of institutionalizing a cultural humility response, especially as you're relating to changing the dynamics of particular inequities. So with the remaining time, I want to talk a little bit more about other strategies. They did a lot of different things. So other strategy you can use to do that. So for institutional accountability, again, the purpose of that, again, if we're looking at cultural humility, is to remove structural barriers, and that requires self-reflection and critique. And maybe people have seen this before, but what does this say to you, anybody? Somebody put the self off mute. What does this say? What is this image depicting? What is it showing you? Somebody to put yourself off mute and give me that in chat. Disparities. Gradually removing barriers to access. Thank you, Michelle. Tear down the wall. Thank you, Linda. Tear down that wall. Yes, tear down that wall. Yes. And so really what it's letting you know that I guess equality is not the same as equity. Reality sometimes looks like the third box there, which is it's such a huge chasm that happens between people who have and don't have. And that really how the world really is. Thank you, Pedro. How the world really is, and that really structures are moving the structure. So even in that Louisiana example, I really feel like they really tried to tear that wall down. The wall sometimes of privilege of who gets hired, who gets in power has really been entrenched in many, many places all over. And that's really like, if you really have to like remove that wall to change the dynamics that exist. So that I think that's important. And so again, it just refers to the processes and the need for models to have the institution have some reflection and critique, and that the goal of cultural humility is at the institutional level is to create inclusive, ethical, and diverse environments. I'm going to ask you just real quickly. I'm going to give you one of these examples because I want to make sure that we have time for everything. So I'm going to give you this example. Here's the first thing, and I'm going to give you about a minute to write in chat what you would do. So I'm going to go with the first one here. So here's just an example that could happen. I don't know if this has happened to anybody, but sometimes the population shifts with who we're really providing services from. So let's just say this was you. You work in an agency where most of the people identify as Black, and the client population is increasingly now identifying as Latino, Latina, or Latinx. You've received feedback that the client engagement in services is decreasing. Okay, that's the issue. All right. You work in an agency where most people identify as Black. The client population is increasingly identifying as Latino, Latina, or Latinx. You receive feedback that the client engagement services is decreasing. Here's the first question I want you to tell them. I'm going to give you 30 seconds to put this in chat. How is this related to cultural humility? Is it? Tell me, do you think it is? Give me a yes or no. Do you think it's related to cultural humility? Yes, no, could be. Yes. Okay. Yes. Okay. And if it is, thinking about everything we just talked about, I gave you lots of different examples of some things you could start to think about with regard to structural interventions that Louisiana did. Other people have talked about other things that people also can think about doing. What might even be your first plan of action or response to this particular problem that also might inform a structural intervention? What would be one of the first things you would think? What might be something you would do? Give me an idea of something you might want to do to help to change that. And I'm going to give you about 30 seconds. Yeah, translation services and education. Okay, what else? I'm going to give you a little bit of time to think this out, so you don't worry about it. What other things might you do or propose to respond to this particular concern about client engagement as it results from a changing population? Hire people who can understand culturally bilingual services. Okay, what else? Thank you, Laura. Thank you, Elizabeth. Thank you, Tessa. Bilingual staff. Ask the clients for their input. Have an honest discussion. Thank you, Timo. I like that. Right. Ask the clients for their input. Yeah, what might be driving that lack of engagement? Employee training. Offer cultural trainings to staff, all staff. Thank you. Is there more that people would also offer? What about doctors that are from the culture? Okay, great. Finding people who are from workshop for the community. I like that too. Thank you. So from the examples that you gave, they may launch, or they may also even be structural interventions that happen. Maybe there's a way that you're institutionalizing the training. Maybe there's a way in which, again, you're getting input from the community that would also change the way in which maybe the programs are done. Maybe the client engagement has to do with some of the things that Matt was talking about, or Patrick, or Duran was talking about, which is around changes in time, changes in structure, language. So some of the things that you talked about that might really help to move that to a different, to more engagement. So that just might be some of the things. Here are some other things I just want to talk about briefly that I think that hopefully could, may inspire you to think of some stuff. Because really when you're talking about making institutional change around cultural humility, you're talking about doing things like the third box on the top, diversity, equity, and inclusion work, which I think many of you may know what that's about, but that's a process. And really it's about really looking at how diversity, equity, and inclusion actually exist in the particular settings that you're in. And I think that one of the things that can be hard about all of this work is really the amount of effort and the amount of time it takes, and also the amount of commitment it takes from all levels, from leadership to the people who are not in leadership. And that things like cluster hiring, which really basically means that you're hiring, not one person. Like, let's just say in that example that I just started to give around the concern around the population shift. Sometimes people will say, well, we'll hire, somebody from that community to be part of the group. And that can be difficult because that person can be the only person from that part of the group, or cannot feel like they're being onboarded in a way that feels comfortable or safe. And so sometimes people are doing cluster hiring where they're recognizing some of the needs that they have and really hiring a group of people together to go through a cohort, so that the person doesn't feel tokenized, or that there isn't a way that feels done in a way that would make it, again, safe for the person to be successful in that organization. There's a lot of people talked about this already, about participatory research and data sharing, really getting information from communities and giving the information back to communities, because I think that's important. Some organizations are doing things like racial caucusing, which is really about having different groups have affinity groups to talk to each other a little bit about what some of the challenges and engaging conversations about identity and how that matters, and how they see the issue around diversity, equity, and inclusion. So that would be an important thing to consider. I know that at UCSF, there's a number of organizations that are some of the programs are going through some of that. And then really anti-racist organizational work, which I think is really what is just been talked about when I talk about the Louisiana example, really looking at the structures of power, really looking at privilege, really looking at who is giving the work. One of the things that as a person who was doing some of those trainings and developing the trainings and coming back to Louisiana, one of the things that was striking about that is really looking at who was in the room and who was at the trainings. And so in the beginning, there was not much representative of people of trans experience, or people who identify as transgender in any of the trainings. And then that moved over time. So really looking at how you can change the dynamics and the ways in which the work is being done and who it's being done by I think takes a lot of effort and takes a lot of thought and respect to make it successful. And then the last thing there is institutional statements, which is really just about making sure it can be as, and then this isn't really simple, but it can be as I would say, as direct as you can just put somewhere what your commitment is to diversity, equity, inclusion, somewhere in the space, somewhere in the room that you're with people, to recognize that matters to you, you know, whether it's Black Lives Matter or whether it's something around queer and trans or whatever the thing is that is truthful and what your institution wants to do, I think is important because that matters to people who are coming through those doors, that they see that you have this commitment to that diversity and that equity and that inclusion. So those are some ideas of things to do, because I think that one of the reasons I'm saying this is I think that sometimes when we're looking at things like homophobia, transphobia, or systemic racism, they are large root causes, and it can be difficult to think of how do you begin to dismantle the power that all of those things have. And I think that some of the strategies I'm selling you, what I've just talked about from Louisiana, gives you those examples. And so in Louisiana, there were some lessons learned that they had and they presented, and I thought it would be helpful to tell you too, that they really realized that meaningful conversations about stigma, specifically racism, homophobia, and transphobia, can take a long time and really require the examination of unearned privilege. So I know that when we were doing some of the training work, but even past that, I know a lot of their stuff, they did a lot of caucusing afterwards, that, you know, really to have people recognize where they derive that privilege from, whether it's from sexual orientation, whether it's from gender, whether it's from race, was not an easy thing for people to really dismantle and to think about. But as we're talking about, again, cultural humility and the principle of critical self-reflection and lifelong learning, it's an important piece, and it is an important piece for people to move forward in the way like I just talked about that they were able to do in Louisiana, to recognize that organizational and institutional change can be slow. There's things that you can do in the immediate, and I think that we've given you some examples of that. But if you're talking about some of the other things like changing the hiring practices or really doing something like that solid initiative, which is really to support leadership from a different lens and for different people, that could be a slow process. And that throughout all of this, you know, I can want this, you can want this, but leadership involvement and staff buy-in are so critical to the success of the work. And sometimes that takes a while to get buy-in. But I think when people understand that it's really under the service of changing the dynamics that continue to happen, that are entrenched with some of the inequities that we see in HIV, I think we can get people on board, recognizing that we've been trying so many different things, and some of the things have been successful, but looking at it from a larger structural sense really can make, as I think Patrick was talking, a larger change and a lasting change. And here's another thing, like just don't rush to solutions. I think sometimes what we do in these things is like, okay, here's what we can do. We can just do this. But to really be questioning why you're doing that, and that sometimes that rush to solution can be done by, this is from Louisiana, can be done by well-meaning white people who want to do something instead of examining their own privilege. Like, let's just do this, let's do this, rather than thinking, wait, well, how are we contributing? How am I contributing as a cisgender male to this particular way in which people are experiencing their not their safety or not feeling like engaged in these services? And so cultural humility, again, is part of it, is recognizing privilege, that prevention efforts, I think you all know this, but this is just to say this again, that solely focusing on individual behavior change will not end the epidemic, that efforts must be coupled with an understanding of the systemic oppression and stigma that are impacting clients' lives. That's the only way that I think we can make some significant change. And I think that this example in Louisiana is something that I think is innovative and have been doing that. And then lastly, I think that there's, you know, in considering structural changes, sometimes there's going to be more questions, you know, or in cultural humility really too, there's going to be more questions than answers. So I think that when you start to examine some of the things that I've just talked about, you end up wanting to even examine more, like how is the assessments that we're doing biased? Do we need to look at like with the questions that we're asking people and the way that we're doing that? How is the data shared and used to inform the practices and policies? What are some of the questions that I really need to know to proceed or determine a course of action, whether it's about the particular people in front of me or what we're doing as a program? What makes it easier or challenging to work with a particular person or community? Like, why am I, oh, this is easy and this isn't easy? Again, looking at it from a cultural humility perspective of critical self-reflection and lifelong learning and power imbalances, really what's happening there. How are the current policies that we're abiding by contribute to the challenges or to the inequities that we're seeing? And then what is some of the historical context that I might not be considering? Someone said earlier, I think, that reminded me of this. Somebody said something about trauma. And so what has been happening to people? Why the engagement or the way in which people are not engaging really may have to do with a lot of historical context, a lot of historical trauma and experiences that people have had that make it so that they are not wanting to continue to engage in the services that you're hoping to provide. So it may happen that way. So I want to just let you know that you can get a hold of me at the California Prevention Training Center. Also, my email is tim.vincent@ucsf.edu. I'm curious to know, before I move any farther, on a scale of 1 to 5, 1 meaning I'm not 5, let me start with 5. Let me start with 5. 5 meaning I have some new ideas, or have some new thoughts about how to make some changes related to cultural humility. To 1, I don't have any ideas and I'm not sure of what I would do to help to move forward with a cultural humility approach. Where would you put yourself right now? 1 is I have no ideas. 5 is I have some thought. I have some ideas. Oh my God, Gloria, yes, 5 with this 5 with the exclamation point. 5. All right. What else? 5. You can be a 1. It's okay. I'm not gonna. There's no judgment. I realize that there should be 6. All right. 4. Thank you. I realize I should have made that anonymous. 5, 4, 5. 100. 100. I love you. You can come to everything. You can come to all of them. 5. A little leadership by and support. Yes. But little leadership by and support. Yes. And then you know what? Actually, thank you for this, because I want to end with one other question though to you, because we have about 1 more minute.
And then Tim, there's a question in chat as well.
Oh, good. What's the question in chat? Tell me.
Well, actually, there's a hand raised. So Tammy Owens, will you unmute and please?
Stop sharing so I can see you.
Tammy Owens, I see your hand raised. Do you want to ask something? You can just unmute or put it in chat.
You're just doing an amen.
Okay, that's a high five, an amen. All right.
No, I don't know. She's a 5. So I guess my last question for you before we move forward is what is your challenge in doing that? What's the biggest challenge for you to moving forward with a cultural humility approach at a larger institutional level? What's the challenge? And I'll give you about 30 seconds to put that in there. You can just tell me what's the challenge. I know that people said they're 5, they have some inspiration, they want to do it, but what makes it hard to do it, or what makes it difficult to manifest that and make it happen?
Work politics,
yes. Staff buy-in, yes. Current politics and policies, yes. And so it's interesting you're saying that, Deb, because I'm talking about Louisiana. I know they're going through a lot of stuff right now. So it's just amazing that they've been able to do what they do with some of the barriers that they have. Doctors sometimes, doctors can be a barrier. Lack of diverse leadership, yes, Gloria, and really having a willingness to look at that. I mean, just not even saying that, but okay, so if we want to change that, what do we need to do to change that? All of the above, Lolita, thank you. Lack of support, yeah. Well, hopefully, again, as we continue today and then tomorrow, we can actually look at some of the ways to hopefully move through some of those challenges. But it looks like, from the people who responded, that you are inspired and you have some ideas about how to move some of this forward. Because I would say, and again, this is me saying this, I would say that, cultural humility is critical and foundational to the work that we do, and to helping to mitigate some of the power imbalances that happen, and to promote health equity, and HIV. And I know that that's what many of us are here to do. So I really hope that this presentation on looking at it from an institutional level was helpful for you. And thank you for being here, and thank you for listening. And I'm going to turn it over now back to Patrick Piper.
All right, let's hear it for Tim Vincent. Thank you, Tim. Let's show some reactions. Use your reaction button and give Tim some love. Give him a hand. Oh, we got some party. We got some love, Tim. There's some snaps, some claps. Don't give Tim the clap. Don't do that. No. Applause. That's what Lady Gaga says, right? Applause. All right. So, thank you, Tim, for that excellent overview of cultural humility. And I want to remind us that, there are some simple things that we could do in the spirit of cultural humility, like, and I put it in chat, like making sure that our agency or our institution has a presence in cultural events that happen. Like it was just Pride Month, or it still is Pride Month. Go, with your agency, have a booth at Pride, or even on your own, go to the parade, immerse yourself in the culture. And that's just one example. But anytime that there's a cultural event going on, make yourself present at those types of things. You're going to learn a lot more about the culture that way. You establish a presence among the community, and it just shows that you are, you're doing your best to educate and experience yourself on other cultures.